Oh my God, yeah. It was definitely like an explosion of relief, basically. Like, my neck is just like, wow, I don't have to hold my head as hard. Yeah.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have a first-time chiropractic adjustment.
Yeah.
So, as her first time, we're just going to go over a couple little things just so you do not get kind of freaked out, I guess we could put it.
Okay.
But yeah, now as you told me, well, one, you're a teacher, correct?
Yes, I am.
Okay, what grade do you teach?
I teach American history, so it's 11th and 12th.
Oh my gosh, you gotta deal with like actual teenager. Oh, I feel bad for you.
Yeah,
I
need it.
Yeah.
Please.
I could imagine the amount of stress that you have with teaching that. Okay, well, not teaching history, but teaching
the kids.
Yeah, 11th and 12th. Oh god, okay.
Yeah.
All right, so your primary complaint is going to be like that upper back, lower neck area, and then you're having some low back issues, and then it was the left ankle?
Yep.
Okay. So what we're going to do, I'm going to put you through some ranges of motion. We're going to go through some orthopedic tests. I'm trying to recreate the pain.
Yeah.
Granted, if anything does bother you,
yeah.
Let me know. I'm not trying to torture you by any means.
Okay.
So what we're going to do, I'm going to start off, I'm going to have you look all the way up at the ceiling for me. Any pain with that?
Yeah.
Yeah? Where
Yeah.
at?
It's like all on this side.
All on that left side?
Yeah.
Okay. If you're to look all the way down at the ground?
Yeah. I feel like I can't even put my head all the way down.
Okay.
Yeah.
And also it's like a pulling. Okay. If you're to bring one ear to one shoulder.
See, this side's easier.
Okay.
But when I do that side, I can't go as far down.
Okay, so you can barely
Yeah.
laterally flex your head to the left.
Yeah.
So I want you to remember that after what we're going to do, we're going to run through those ranges of motion again.
Okay.
And I want you to just kind of remember where you are and what you're feeling.
This much compared to like actually getting my ear to my shoulder. Yeah.
Correct. Now I want you to look over either shoulder.
Yeah. So that's not as bad, but I feel it pulling on the side.
So you feel it pulling?
Yeah.
Okay. So what I'm going to do, we're going to do some orthopedic tests. Sit up nice and straight for me. I'm going to push down on the top of your head.
Okay.
Any pain with that?
Not really.
Okay. We're going to turn your head to the side.
Yeah.
Okay. Where at?
It's like all in this crease.
Okay, did the pain stay here? Did it travel down into any arms?
I can't remember.
Can't remember?
Can't remember.
All right, let me do
Okay.
that one more time.
Yeah, I can feel it like in my shoulder a little bit, but that's
So you
as
feel
far.
it's not going all the
No,
way
it's
down?
not going all the way down.
Okay. I'm going to turn to this side.
Yeah, you cracked me some there. Already, yeah.
All right, and pain with that?
It's over here still.
So everything more on this side, okay.
Yeah.
And now typically, do you feel pain on that,
Yeah,
does the pain,
that's
so
where
it
it's
goes
all.
into the shoulders. Do you ever notice it going into your arms, elbows, hands?
Not
what's
really in my
that?
arms, just like, if anything, right here at the base of my neck, and that's about it.
Okay.
Yeah.
All right. So what I'm going to do, I want to lift up. Any increase or decrease in pain? Or stay the same?
Stay the same.
Okay.
Yeah.
All right, good. All right, what we are going to do, I want you to lay face down for me. I can take your glasses for you.
Thank you.
You're welcome. Okay, so how I start every adjustment is we're going to scan the entire body. We're going to look at the right side compared to the left side. We're going to be feeling for any hypertonic muscles, any taut, tender fibers, which for you, I definitely feel it across the traps. So we're going to be doing the massage device really to relax up top, and then we'll see when we get down lower if you need it down there as well.
Yeah. Well, even when you pressed on my hip right there. After
Already?
Yeah.
Okay. All right, so I'm going to start with palpation. Let me know if any of this is tender to the touch.
No, it's fine by the touch.
Okay, good. Now when I get...
Yeah.
Okay, so it's really right up at that T1 region is where she's feeling majority of the tension. Okay, we're going to keep going lower through the thoracic spine. Is any of this painful to you?
No, not yet.
Good. Not yet. Okay, so we're going through that thoracic now, getting into the lumbar spine.
Yeah, that's where it starts to hurt.
Okay, more on the right side or more on the left?
Left.
Left, okay. And we're going down. Now we're going to get to the SI joints. Any pain when I push on the right side?
Not quite.
Any pain?
Yeah.
Okay, pain directly over the sacrum.
Yeah.
What about the left? Okay, so majority of the pain was actually felt right over the sacrum. What we're gonna do, we're gonna come down here, we're gonna check the leg length out. Now, as you can tell, she's pulling right short quite a bit there. So we're gonna follow this leg and make sure and get this balance before she takes off today. So even when scanning up the body, so actually the hips are looking pretty level here, which is a good thing. Yeah, I'm not really seeing any major shifts in the symmetry when I scanned up, so that is a good thing. But let's go ahead, we're going to first use the, well, it's not the Hypervolt, we're going to be using the Raptor today. We're going to use the Raptor and we're going to relax the muscles up through here. We're going to bring it down into that mid-back. So what we're going to do, I like to start all my adjustments up top at that cervical thoracic joint here. Okay. So we're going to start on that left side. We're going to do a T2 on that left here. Actually, first, let me explain to you. So just because this is the first time ever getting adjusted, the pops, the cracks, the noises that you're going to hear, it's almost, it's a gas that's leaving the joint. Now, granted, when you crack your knuckles, you hear it, but now the difference is right here is a lot closer to your ear.
Yeah.
It's going to sound a lot louder. Okay?
Okay.
Alrighty.
Oh.
There we go. You feel how that pressure is taking off the nerves there? I'm going to drop in on that right side here.
Oh, God. Dude, I told you, man, my neck is fucked up. So excuse my language.
Jordan, you ran out of storage.
Okay, we'll use your phone, sorry.
Okay. I want you to take a deep breath in and exhale out.
Oh, thank God.
One more time. Deep breath in and exhale out. Good, good. So already right through there, those were your first adjustments ever.
Yay.
How did that feel?
Feels great.
Not scary or anything?
No.
Okay, good.
As long as my neck's intact, we're good.
Alright, so we're going to come back down here. I want to check the leg length out. And then keep your face, flat for me. So even just with that, so it's not fully balanced as you can tell. Still short on the right, so we still need to work a little bit lower into the hips. Now, when we were originally checking the sacrum, you did have pain directly over that sacrum. So we're going to do the same thing right now. I'm going to stabilize right here. I want you to raise this leg up as high as you can. Not from, like that for me. So we're going to stabilize, raise that leg up as high as you can. Any pain, tenderness, tightness with
Yeah,
it?
I feel it pulling all my lower back.
Okay, relax that side. Raise the left side for me. How does that side compare to the right?
Not as bad, but like it still hurts a little bit.
Okay, so the right was a little bit worse?
Yeah.
Alright, I'm going to have you just drop a tiny bit down on the table. Perfect right there. Now the table is going to come up from below you, but let me show you what's going on just so you do understand and kind of understand why I'm making the adjustment. So the right side is a little bit harder for you, correct?
Yeah.
Okay, so what that's telling me is that sacrum, that sacral apex is pointing more towards the left side. So the right side, the ligaments from here to here, they're a little bit tighter.
Yeah.
So it's restricting that leg from going up.
Yeah. It's probably because I put more pressure on my right foot too.
Okay.
Yeah.
So things like that you do notice.
Yeah.
So yeah, so what we're going to do, we're going to do the drop. The table will come up from below. It will be a P to A drop going down. And then what we're going to do, we're going to have to do a counterclockwise torque to get that back towards that midline.
Okay. That was scary watching you do his. Oh, my hips.
Okay, so we want to cross that right foot, over the left. Table's going to come up from below. No, relax, relax. Okay. Keep that foot crossed. And relax. One more. Good. Uncross for me. I want you to bend this knee. Yep. And one more. There we go. Okay. So I'm going to stabilize right here. I want you to raise that leg up for me again. Do you notice a difference?
Not a huge difference.
Okay. So
It's pulling a little different.
it's pulling a little different?
Yeah.
Alright. Well, what I'm going to do, table's going to come up. Good. Bend that knee again for me. Yep. I'm going to do 2 more drops. This is the last one. Good. And relax. So I want you to raise that leg up again for me.
Yeah.
How's that feeling?
It doesn't pull as much.
Okay.
Pull really.
So a little bit easier. So that means 1, we cleared out sacral, but what that's telling me, we're still having some more lumbar involvement.
Yeah.
So we're going to do the side posture adjustment. So what I'm going to have you do, lay on your side and face me. Lay that up. Bend this knee. Yep, just like that. I'm going to bring it up. There
Do
we
what
go.
you do.
Perfect, just like that. Good. Flip to the other side. So we're going to bend that knee. Perfect. Around.
Oh yeah. That was a sign that needed to get cracked.
Lay flat on your back for me.
Okay.
There we go. Okay. So now what I'm going to do, I'm going to do the leg pull. You may feel that in the ankle and that knee going to the hip as well.
Okay.
So we'll start on that right side here.
Oh, yeah, I felt that one in the back.
Okay, we'll do the left. And you felt
Yeah, in my ankle.
that release really big in the ankle
Yeah.
there. Okay, so I'm going to have you sit on up. Come forward. Good. Okay, so we got a lot of movement already.
Yeah,
So, which is a good thing, taking pressure off those nerves.
yeah,
That side posture one was a big one that you needed.
yeah, definitely.
Okay. So what I'm going to make sure, we're going to do the, how we originally did the prone thoracic, now we're going to do the anterior, the supine adjustment here. So I'm going to have you give yourself a big hug. Good. And with this, I want you to take a deep breath in. I'm going to bring you down, exhale out. Good. We're going to come up just a little bit. One more time, deep breath in and exhale out. Good. Already nice and cleared out. You can relax there. So we're going to do the Y strap now. Now I know this is the one that you're worried about. This is going to be the one where you're actually going to get the most relief from. So this is going to go over the head. If you could pull your hair through for me. Oh, perfect. Thank you. Okay, so you're going to feel a lot of movement with this one here, okay? So I come up in that top of the table. We're going to distract in that Y-axis direction for me.
Okay.
There we go.
Oh my God, yeah.
And relax.
Yeah,
You feel how that just distracted the spine like that? Yeah, that gets a ton of movement. That takes pressure off the nerves from that upper cervical spine going all the way down the back.
yeah.
So yeah, just relax there. You get a lot of movement. Here, we'll take this out. Good.
Oh, jeez.
So now, yeah, that in general was your first adjustment you've ever had. Obviously, the first Y strap you've ever had.
Yeah.
Did you ever think your body was gonna ever move like that?
No, definitely not. My whole neck is just like, it's
All right,
on
I'm gonna
fire.
have you come on up. There we go. Got a ton of movement. Really got a lot of pressure getting taken off those nerves.
Yeah.
Yeah. You remember
Real
how I,
sore.
yeah, you remember how I told you originally? It's almost like that original pull. You get that like shock, and then you gotta let the neurons fire, and you let your body just kind of get back to an equilibrium.
Yeah.
And you really start noticing that difference. If you were to tell anybody at home that has never had that Y strap done, how would you describe it?
It was definitely like an explosion of relief, basically. Like, my neck is just like, wow, I don't have to hold my head as hard. Yeah.
If anyone is looking to schedule an appointment, just go right to the website, drjosephcipriano.com. Send me a message right on there, and I'd love to get you in.
Thank you.
Have a good one, everybody.
Thanks.